Hi everyone, I'm Saleha and this is Chai Chat and Community. Tonight I'm joined by Dr. Rithvik Reddy, an ENT from Sydney, who recently made medical history in Australia by performing cochlear implant surgery on baby twin boys on the very same day. Am I right, Rithvik?
Hello, yes. Yep. How are you, Saleha?
Good, thank you. So, ear issues can affect us at any age, whether it's a toddler with recurring ear infections or an older person struggling with hearing loss. And today we are going to be chatting with you about how to keep it simple, breaking down basics, and basically sharing advice that family can relate to. So, thank you so much for joining me.
Thanks for having me.
So, we know you're a top ENT surgeon, but before we go into your operation theater, can you tell us something about yourself, please, and what made you want to help people, especially kids, hear the world?
Yeah, definitely don't feel like a top ENT surgeon. Just starting
But
my
you are.
career,
You've
but
just made history in
well,
Australia.
yes. Feel like a bit of an imposter, to be honest. But I was born in India. Both my parents were sort of training doctors at the time. And I lived in India for the sort of first 5 years of my life, after which my parents wanted to make a better life for themselves, I guess, like a lot of people who left India around that time. So they actually moved to New Zealand for a bit, tried to go through the whole recertification period, actually found it quite hard initially, um, and then ended up moving to Australia when I was about 10. And then I grew up sort of in regional New South Wales in the Hunter Valley um, and Newcastle until medical school. And I went to medical school through Newcastle. And then I got on to surgical training and then travelled around New South Wales. What made me want to help children, I guess, I'm an only child and I always wanted a sibling. I never got a sibling, but I played a lot with sort of um, other kids, family friends and things like that. And I always found pediatrics as something that was rewarding. Um, Going through medical school, it was really a toss up between pediatric surgery and ENT. And I ended up choosing ENT after sort of a placement in Nepal, where I saw the big impact it could have on people.
Do you want to tell that story that you told us for surgical news?
Yes. So,
How you got into it?
yeah, it was totally by chance. I didn't really know what ENT was. I was in my third year of medical school and I was at the start of a 8-week placement in Pokhara, Nepal. And I walked through the library on the introduction tour and saw that the section in the library on ENT was bigger than the section on general surgery. And I thought, what is this? Like, I've never really heard of this. I'd love to see what it is. And general surgery was full for the first 2 weeks anyway. So I thought, oh, I'll do a few weeks of ENT, but I just loved it. The clinicians there, you would sort of see 50 patients a clinic. There'd be patients sort of waiting on a bench in the clinic room whilst other patients were being seen in the same room. And these clinicians would see these children, adults with ear conditions and throat conditions and cancers. And I remember distinctly,
Cancers in the ear.
yeah, well, no, head and neck cancer, sort of
Oh,
of
head
the,
and neck, of course. ANT,
yeah,
sorry. Yes, of course. Yeah.
yes. And they would take a little cotton spear, spear the discharge in the ear, smell it, and sort of get you to smell it and say, okay, that's Pseudomonas. That means this is cholesteatoma. Book them for this operation. And it was almost like traveling back in time. It was like, so you're not going to get a scan or a hearing test. We'll do a hearing test. We can't have a scan. We'll just book this operation. So it was very clinical. But the thing that was great about it was I remember seeing kids having their tonsils out and having a great benefit from that. Kids and adults having ear operations that were obviously having a great degree of suffering from discharge pouring out of their ear, right the way through to 70, 80-year-olds having cancer surgery, removing the maxilla. Um, and I just thought, wow, it's a really wide specialty. And I read a lot of those books that were sitting in that library section. And I thought, well, this is really interesting. Like, there's no physician counterpart to it. There's not like a neurologist for a neurosurgeon or a cardiologist for a cardiothoracic surgeon or a nephrologist for a urologist. It's just ENT. So it was interesting in the sense that you got to manage all aspects of patients who present with those conditions.
Wow. So we're going to talk about your operation that you did on the twin baby boys, an
Mhm.
8 hour. I'm going to read this out so that I don't get it wrong. 8 hour cochlear implant operation on the same day.
Yes.
Yes. And no, yes.
So it was two twins who were born with this condition called connexin 26 gene mutation. So it's a
Which
condition,
means, sorry. Yeah.
yeah, it's a condition that affects the ions of the inner ear. So you don't get an appropriate action potential forming. So their cochlears aren't able to transmit sound like a normal person's cochlear. Um, so as a consequence, it's the most common cause of genetic sensorineural hearing loss in children. Um, and as a consequence, because they were identical twins, they were both affected by this gene. They actually had quite a rocky episode early in life. They were born premature, and they spent a long time in the hospital. Um, when they eventually got to go home, the parents were then faced with this challenge of, okay, well, they're profoundly deaf. And as a consequence, they had to have hearing aids. Hearing aids in children are incredibly difficult to manage because they often pull them out. Multiply that by two. And they had another kid at home too who was walking around
Oh,
and bringing home illnesses. Um, and then there was the organisation of trying to get their surgery done, which involved having 8 hours of operating time, an anaesthetist, trying to get it all done on the same day in the same place, which was a bit of an organizational ordeal. And of course,
sorry. Did I lose you there?
um,
Sorry.
sorry, I
No,
got you
that's
again.
okay. I thought I lost you there. No, that's fine. Uh,
Hello? Sorry, I
yeah,
lost you for
no,
a
I can
sec.
hear you. I can hear you.
I don't know if that was me. It might have
That's
been me.
okay. We'll continue.
Strange.
Yes.
Um, Sorry, I don't know where you lost me.
I lost you about you talking about the anesthetist.
Yes, so we had to organise for an anaesthetist to be comfortable in managing kids that were ex-premature kids. We thought about doing it upstairs in the private because it would just be more timely for the poor parents who were struggling with the situation. But it was deemed that it was just too complicated, so we had to do it at the Children's Hospital downstairs. And then we had to reorganise it twice because the kids got sick. One of the twins got sick. So then they had to pull the older kid out of daycare. So the surgery in itself wasn't anything special. It was just doing a bilateral cochlear implant twice. So doing four cochlear implants in a day, one in each ear of each boy. Um, that morning actually got a bit delayed because I had to help an anaesthetist who was struggling secure an airway in another operating theatre. Um, so the surgery didn't start as expected at 8 o'clock. It sort of started around 10. So we finished at about 6, which was reasonable time.
So, how long did it take for the twins to hear sound clearly?
Yeah, so they got switched on about 2 to 3 weeks later, um, which is about standard 7 to 10 days later. And they got switched on, as you probably saw on the news story, with the camera crew there.
Yep.
And when you get switched on, suddenly, for the first time, they experience sound. And the thing that was so important for us and me, despite all the hurdles of reorganizing and sitting and trying to work out days and cancelling things, the most important part was that both twins got to hear mum's voice on the same day at the same time, which I think really made it feel special rather than having to do one, wait another week, do another, and either delay one or, do it separately. Um, so that was good.
That's fantastic. Wow, I can just visualize the mother.
Yes. Yeah. A lot of noise
Now,
all at once.
all at once. So, for people like me who really don't know what a cochlear implant is, Can you
Hmm.
explain it in simple language? And how does it help a child who's born deaf to start the process of sound?
Yeah. So the way that we hear simply is sound is a vibration of air particles. Um, that sound then vibrates our eardrum, which is attached to three little bones of hearing that in turn vibrate and actually amplify that sound. The last little bone then connects to the cochlea, and the cochlea is filled with fluid. That fluid vibrates or forms a wave that travels along the cochlea. And as the fluid moves, it moves tiny little hair cells that sit in the cochlea. As those hairs move, they open up ionic channels that generate an electrical potential that is then effectively a sound signal or electricity that is transported via a nerve to the brain. So, 1 in 1,000 children in Australia are born with some form of permanent cochlear or nerve related hearing loss.
Is
And
it
the most,
hereditary or is it hereditary?
yeah, so about 60% of causes in Australia are genetic,
Oh,
but they can be non genetic as well. So they can be infectious.
yeah.
Um, So certain viruses that mum can have in utero can cause it. It can also be due to anatomical structural malformations that occur when the child is being formed. But effectively, a cochlear implant works by stimulating that nerve directly. So often the mechanism of the hearing loss is in those tiny little hair cells, in that they're not able to generate that electrical potential that's required to stimulate the nerve. So a cochlear implant takes over that function, either in a child or an adult. As we age, with a condition called presbycusis, which is age-related age-related cochlear hearing loss, you lose some of those hair cells. They sort of die off. They get affected either by noise exposure, family history, medications that we take, and aging. And
Yeah.
through that process, they're not able to generate that action potential or that electrical current. So a cochlear implant replaces that.
So thank you. I want to talk about everyday ear health, which is so important. So for new parents, what are some of the subtle signs that a baby or a toddler might be struggling to hear?
Yeah. So I think it's things like not responding to sound, not responding to loud noises. We're very fortunate in Australia that every child that's born is screened for
Yep.
newborn sensory neural hearing loss. And it's actually not a shortcut screen, which is often done in America and the UK. It is sort of the gold standard of screening, which is called an automated ABR. So I only really recently saw this because my daughter was born 8 months, not 9 months ago now, and she had to have the screen, and it was no pressure on her to pass the test. But she had these little electrodes that were placed on her scalp and forehead, and these little headphones that were put on, and effectively a sound is driven through to the ear, and as that's driven, the brain waves are recorded. So you check the whole spectrum of where things can go wrong. So often when kids are born profoundly deaf, they're recognised in Australia. We, we,
Immediately?
we, yeah, we get referred them. So they have that screening test before they leave hospital generally.
Yep.
And if they
Yep.
don't have it, it tends to happen within the first week.
Yep.
And then there's
Yep.
various referral pathways. So in New South Wales, if you're born in a certain postcode that refers to Sydney Children's Hospital, you tend to get referred to either myself or one of the otologists that works there. Um, Whereas later in life, the more common causes of hearing loss that I see in kids is fluid in the ear
Yep.
or glue ear. That is quite common for kids to present with that. And that often presents with speech and language delay. That tends to present a bit later in life. Fluid in the ear can also present with delayed motor milestones. So crawling, looking off balance, wobbly walking, things like that, or delayed walking. But speech and language delay is probably the biggest thing that it presents with. sometimes you'll see a more mature kid come in, and the parents will say, he says he can't hear, or he keeps saying what. Um, so yeah, those are some of the presentation signs.
So when you say he keeps saying what
Mm,
age is that? I mean, is that a toddler age or is it? The reason I ask is I hear a lot of young people now, if you
mm,
ask them a question, we would normally, our generation, we'd say, sorry, what did you mean or beg your pardon? But then your kids, they say what? So is
yeah.
that, so what age? Would it be a toddler age or a bit grown up, school going kids? Is there
Yeah, I mean,
concept? Yep.
we sometimes see kids before school even saying that. I mean, I sometimes get parents coming in with 3-year-olds, and the 3-year-old will go, huh? Or what? Or I didn't hear you. But that's rare. It's probably more common, as you rightly say, in 5-year-olds, 6-year-olds, things like that, for them to expressively say, I feel like I can't hear.
Wow. Learning a lot.
Yeah.
Thank you for that. So this is something I had to ask you because I travel to work by train and see everyone with earpods. Doesn't matter the age, grown-ups, children, primary school kids taking the train, secondary school kids taking the train. You and I are using earpods. So, um, what is the rule of thumb that you have about the volume levels or the headphone safety that we don't accidentally, we can talk first with children and then gradually maybe go up to even, my age and a bit older. Because everybody, whether we like it or not, we all use earpods.
Yes. I think there's certainly safe listening levels and safe noise levels that are described. Um, so, for example, there's workplace monitoring and workplace health safety checks. So, for example, in the army, every applicant for the army has a hearing screen done, and there's strict rules about at what level of noise requires what level of hearing protection, and for how many hours you can be exposed to certain noises. I actually have an app on my phone called Decibel that I sort of look at every now and then when I go to a loud place to check what the noise level is and check how long I've been exposed to that noise. Um, but in terms of AirPods, I think they're very common. I think there are certainly concerns with it, with younger kids having it and maybe turning the volume all the way up. But generally, the volumes that you need to cause permanent hearing loss is uncomfortable. Like it's
Okay.
almost painful. Um, so I would imagine that that doesn't really have a huge impact, I would hope. Of course, there are some people who are genetically more prone to noise-induced hearing loss, and as a consequence, it probably doesn't require higher levels of volume. But certainly, I guess growing up, there were certainly kids that listened to very loud music and played in rock bands and things like
Yeah,
that.
I was going to say,
So
ask you that. Yep.
what we call a transient threshold shift. So that is a shift in your hearing level where you get exposed to a loud noise for a prolonged period of time. You leave the concert and your hearing feels muffled,
Yep.
is actually significant. That actually means you've done permanent damage to your ears, especially if you've got some form of tinnitus associated with that or the ringing in the ears.
Yep.
That is bad. Um, I'm sure it would make a lot of sense for people like Apple to have noise threshold checks that they would automatically alert people for. I don't know if that exists, but I have to look into it. But that would make a lot of sense to sort of turn it down.
Yeah. Um, so, hearing loss or medical procedures can feel overwhelming. And what reassurance would you give as a surgeon to a family who's worried or scared about asking for help?
Yeah. Um, I mean, this stems back to what we spoke about a bit earlier, in that hearing loss has this stigma of being a real disability, whereas other common, it's so common. In fact, it's
Like
probably
you
one
said,
of,
me wearing glasses.
Correct. You wearing
Yep,
glasses, I'm wearing contact lenses. There's no stigma surrounding that. In fact, some people wear glasses when they don't need them.
yep,
Um, that all of a sudden you have to wear a hearing aid and everyone thinks that you've got a disability.
yep.
I think that's quite sad. And hearing loss in itself has been linked as the largest modifiable risk factor for dementia. There was an article published, yeah, in sort of a few years ago showing that if you have hearing loss, because it's modifiable, you can treat it with hearing aids. It is more significant for your risk of dementia than blood pressure, smoking, drinking, cholesterol. Um, and that has to do with the relationship that hearing has with our social world. So it's not uncommon that I see patients come in, especially the older patients that come in, that sort of feel isolated. I saw one patient who really sticks in my mind, who was a bit earlier this year. He'd come with his wife and son-in-law, and he'd kind of sit there, and I would almost have to write down what I was saying, or I'd use an app for that. But his family spoke for him. His son-in-law did all the talking. He just sort of sat there and let the whole sort of consultation happen, and I'd sort of check things by him. And that was in a consultation with him about his hearing, like leave alone a family gathering where they're probably just going to overlook
Yep.
him. And then I did a cochlear implant on him. He was a great candidate. Um, and he came back and he was so thankful that he actually asked for the other side to be done. But he suddenly felt like he could experience the world again. He could
So he
experience
belongs suddenly.
gatherings. Correct. He actually used the word, I don't feel like a pot plant anymore, which I think really highlights the stigma that hearing loss has. It's invisible. Often you don't see it.
Yeah.
Often the elderly just recluse. Hearing loss is associated with depression. It's associated with anxiety. It's associated with social isolation. And as I sort of highlighted, it's associated with cognitive decline and dementia. But it's correctable. So if you have mild hearing loss, then you have twice your baseline risk of developing dementia. If it's moderate, it's three times. And if you have severe hearing loss that's untreated, you have five times your baseline risk of dementia. And if you
Okay.
treat it with hearing aids or a cochlear implant, that risk reverses. So I
Wow.
hate to
I
I hate to scare everyone, but
no,
it
this
is
is,
something that's important.
yeah, and especially as you grow older. But yeah, um, I have to send this to my father-in-law because he will not wear
Yes,
a hearing aid. And as I
yes,
told you earlier, my dad wouldn't wear one because he was too vain. But anyway,
yeah.
um, so so what are some of the early signs for older people that
Mm.
they may be losing their hearing, and why is it so not important? Why is it so important not to write it off?
Yeah. So, I mean, we've just highlighted the importance of
Yeah,
not writing it off. I think it's well proven medically, and just if you think about it, like if you can't hear, you can't listen, and if you can't listen, you can't communicate. And communication really forms the basis of what we are as a social being. It forms our family structures, it forms our social structures. It's what we derive entertainment and pleasure from. If you can't watch TV, if you can't listen to music, if you can't talk to your family, it becomes difficult to have a meaningful, enjoyable life. What are the early signs? Well, it often presents fairly insidiously. You often ask people to repeat themselves. Typically, it presents in background noise. So you're out at dinner, it's noisy, you can't hear the person across the table from you. Um, and then it sort of gets worse to the point that you can't hear conversations. The TV volume isn't quite high enough as compared to other people who are sitting next to you. You notice that your volumes are creeping up. And then, more insidiously, as I said, you might notice that your loved one isn't really listening to what you're saying. You're sort of having a conversation or asking questions, and they kind of just say, "Yep, yep, yes," because they're a bit embarrassed of the fact that they didn't hear what you said, or they've asked you to repeat yourself so many times that they're just happy to accept what you've said.
yeah.
Um, And yeah, it's important to look into that. Go and get a hearing test, check what your levels of hearing are, and then encourage your loved one to treat it and just explain that it is important. And whenever I see patients with hearing loss, and I try and work out what's going on, of course, but one of the most important questions that I ask when I see an adult with hearing loss is, what impact is it having on you? Is it affecting your ability to work? Is it affecting your ability to communicate at home? Is it affecting your ability to go out and enjoy life? Um, and that those might be the scenarios where you have to treat it, right? You don't have to wear a hearing aid when you sleep. No one does that, just like you don't
Yep,
wear glasses when you sleep.
absolutely.
But wearing it in scenarios where it might help. And hearing aids are nowhere near as good as glasses or contact lenses. They're not perfect. In fact, they're far
But
from
we've
it.
come a long way.
Yes, we've come a long way, and sadly, they're the best we have at the moment.
Yep.
So, um, provided we don't fix things with nerve regeneration, which is currently being trialed,
Whoa.
um, sadly, hearing aids are what we've got.
I'm now hearing you get a hearing test done free of charge when you go and get your glasses.
Well, I
Okay, so
and
you just
maybe
scared me there.
yes, maybe I'm a bit of a cynic, but a lot of those companies that do that obviously are owned by shareholders who benefit from selling hearing aids or
Okay.
prescribe pensioner hearing aids, which are free, but really they're costing the government something. I think um, there are good audiologists and there are audiologists who try to sell hearing aids. But
Okay.
that's a discussion for another day, maybe.
That's a discussion for another day. Last
Yeah.
question of the evening, Rithvik, is, and this is very close to me, is ringing ears. What exactly is it, and how important is it to go to an ENT if you have ringing ears and you have issues?
Yeah, so tinnitus is incredibly common. It's one of the most frustrating presentations that I see because often there isn't a cause and there isn't a terrific treatment. There isn't a tablet or a surgery that makes it go away. That being said, I see a lot of tinnitus. Um, Tinnitus is more common as we get older. It's often associated with some form of acoustic trauma. So either noise-induced hearing loss or trauma to the head or tension in the area, so from the jaw joint or the teeth. It can also be affiliated with certain medications that might increase the incidence of it. And then there's medical conditions that cause tinnitus. So things like Meniere's disease. And very, very rarely it can be due to conditions affecting the nerve of hearing or balance. So small tumors, benign tumors of the nerve of hearing or balance. When we see patients with tinnitus, we take a history to try and delineate some of those things. We often get a hearing test to go with it because, as I said, hearing loss is often one of the most common causative factors for tinnitus. And then if tinnitus is only affecting one side, that sort of raises a few alarm bells to make sure there's not something structural going on in that ear. So when that's the case, we often get an MRI scan to check that there's not something that we call retrocochlear pathology or pathology within the cochlea or the nerve of hearing. The management of tinnitus, so generally consists of a few things. The first thing is trying to, as easy as it is to say and difficult to do, is mitigate risk factors. So stress, tension in the jaw joint, maximizing sleep, avoiding things like caffeine and alcohol. Easy to say, really difficult to do. Um, the second thing is environmental noise often helps. So tinnitus is a bit like a candle in a dark room. When there's no background noise, it's obvious. Um, like when you're trying to go to bed and all the sounds are off. So in those scenarios, I say it's important to think about turning the light on in that sort of metaphor of playing some background noise, playing some white noise, some brown noise, some rain music, some waterfall music, having the radio on, sleeping with the TV on a timer. Um, Patients that struggle to fall asleep often find use in doing things like that, having the fan on, for example. If you've got hearing loss and the tinnitus is particularly bothersome during the day, then a hearing aid might be beneficial. Of course, no one sleeps with a hearing aid, so it's not going to help you get to sleep
Yeah.
or put you back to sleep if you wake up because of the tinnitus. And then the other thing that has a real growing body of evidence is cognitive behavioral therapy. So something called tinnitus retraining therapy, which is effectively a form of psychotherapy that teaches you to not deal with the tinnitus, but sort of understand it, recognize it as a sensation, recognize that that sensation does not have any harmful connotations with it. It doesn't mean that your hearing is getting worse or that something's going to explode in your brain. It's a noise that's there, and that tends to help patients move on with it. But tinnitus can be horrible. I've had a patient suicidal from tinnitus who was admitted to a psychiatric hospital as a consequence from it. Um, it's no joke, but it's really difficult to treat. It would be amazing if there was a tablet for it or a surgery for it, but sadly, it's so multifactorial that that's not the case.
Wow. Wow. Okay. This is a bit scary, but thank you so much for joining me tonight and
That's right.
sharing your advice. And to everyone listening, if this episode gave you a bit of peace of mind, despite what Rithvik just said at the end, or if you know are a parent or a family member who was worried about your health, please do share. Keep safe, and until next time, goodbye.